I think the biggest differentiation between my group and other spine groups is we want the patient to feel better, but that doesn't necessarily mean we have to do surgery. So yes, we're spine surgeons, and obviously that's our primary thing that we do, but there are other methods for treating spinal disorders that don't need surgery, and we've usually, and if possible, we'll try those other methods before opting for surgery.
I think what makes our practice unique is, first of all of us trained in some of the finest institutions in the country, but we weren't just focused on one particular small area of spine. So there's a lot of programs out there who where their expertise is in degenerative disease or it's in deformity, and they don't get a lot of experience in all the other things. So for all of us, our training was really pretty broad and extensive. So we do minimally invasive surgery, we do spinal deformity, cervical, thoracic, lumbar, we do degenerative disc disease, we do tumors, we do infections, we do pretty much the whole gamut of spine surgery because we were trained to do all of that.
When I see a patient for the first time, I'm trying to figure out what they're there for. Why did they come in? And frequently they're not even sure, or they think they have one thing, but it's actually something else. So I always tell them that we need a diagnosis. We need to know why you're hurting and where it's coming from, whether it's one thing, whether it's more than one thing, and what are the mitigating factors. And that just involves a conversation, asking the patient questions. Truthfully, with all the new technology we have, MRIs, CAT scans, all that stuff, it's not that new, but diagnostic procedures that we have, about 85% of the diagnosis is made on what the patient tells us. The questions we ask, how they answer, and then about 10% is how they move, what the physical exam is. Those findings tell us a lot. And about 5% is the correlative findings of the MRI and stuff like that. So I'm just telling you as a patient, if you go in somebody and he doesn't examine you or ask you much questions and he just looks at your MRI and he tells you need surgery, run away. Because the MRI does not tell you that. The symptoms do. The symptoms and the examination tell you 95% of what you need to know.
The people that schedule you to come in and see us are people that I see every day, and they're extremely good at what they do. They make sure that they try to accommodate what your schedule is, getting you in to see me so that we can take care of assessing what the problem is. The people we have in our office, they do a tremendous job of making every person feel like their issue is being addressed. And so that's where I feel like every person that works in our organization has the goal of addressing your problem.